My name is Chad Smith and I'm a physician assistant here at MSA Hand Center. This short video segment is regarding trigger finger. Trigger finger is inflammation that occurs right at the base of each finger and the thumb. Your flexor tendon is tacked on in several intervals all along the finger, and that becomes inflamed, and then your tendon will catch on one of those intervals, and we call those pulleys. It's painful to the touch. What happens is it locks up when you're doing manual labor type of activities, or if you're sleeping and your hand becomes relaxed and then you want to try to open up, and in the morning it becomes locked or it triggers and you have to open your finger up. Trigger finger usually occurs with repetitive activity. As we age, that space in there where your tendon glides becomes less or more entrapped. Some people are predisposed to have trigger finger. It can be genetic. It can also be contributed to work-related activities or a lifestyle of manual labor. You can have associated arthritis with trigger finger. It can be secondary to your trigger finger. When it comes to trigger finger, you're not burning bridges by not doing anything about it, but it is likely going to get worse and more painful for you. Trigger finger can go away on its own if you modify your activities, try to reduce what's causing the finger to become irritated, and taking anti-inflammatories can sometimes help. Sometimes a cortisone injection placed right in here can reduce the inflammation that occurs there. If a patient fails conservative treatment, the option at that point is to have a trigger finger release. When it comes to surgery, this is something that can be done in the office if it's one or two isolated fingers. If it's more than that, it's something that's probably best to be done outpatient. But if it's done in the office, usually a field block is done to make your whole hand go numb, and then a small incision is made here and down to the interval where that pulley is released. Your wound is sutured up and your hand is bandaged. So you don't really have any hardcore restrictions in your post-op recovery process, just being mindful of the wound. It's not hard to recover from trigger finger release. The most important thing you want to do is wound care and modify your activities. When it comes to trigger finger release, I typically see patients around the 10 to 14 day mark. We'll look at the wound to see if the sutures can be removed at that point. I'll talk to you about activity modifications. There's not really any hardcore restrictions regarding to return to work. You just want to be mindful of the wound. Sometimes occupational therapy is justified. What I found in the past is that when patients have a trigger finger release, sometimes this knuckle right up here will become stiff because of pre-existing arthritis. So when you have surgery, it does aggravate other pre-existing conditions. So in that recovery process, that's something we might decide to do, is that if a home exercise program is becoming difficult for you to recover from, we'll have you see one of our occupational therapists here. Every trigger finger is unique. If you feel like you're experiencing these symptoms, please give us a call here at MSA Hand Center.